Hi everyone, let's start the second part of my second lecture of the pelvis. So in this part I will talk about the male internal genital organs. Male internal genital organs include the prostate, the seminal glands, the two seminal glands, ductus deferens, and also bulbourethral glands. Those are small glands, also part of the male internal genital organs. So the ductus deferens, already I mentioned in my first lecture that it begins as the continuation of the tail of the epididymis. You have seen that in my first lecture, you have seen that picture. So ductus deferens, it begins as the continuation of the tail of the epididymis, then it courses through the spermatic cord, and through the spermatic cord it enters into the abdominopelvic cavity through the superficial inguinal ring. Then it passes through the inguinal canal and it enters into the pelvic cavity through the deep inguinal ring. Here is the deep inguinal ring. So you can see this is the superior view of the pelvis, superior view of the pelvic cavity, and you can see here is the deep inguinal ring. So ductus deferens enters through the inguinal canal and then deep inguinal ring, and then ductus deferens it passes over the external iliac vessels, and then it goes behind the urinary bladder. This is the urinary bladder and here is the rectum. Behind the urinary bladder, on the base of the urinary bladder, the two ductus deferens from both sides. So you can see here, this is the urinary bladder and this is called the base of the urinary bladder. So ductus deferens, when it goes posterior to the urinary bladder, it crosses over the ureter. So on the both sides, the two ureters are entering into the urinary bladder here, and ductus deferens crossing over the ureter, and then they are coming together in the midline, and the terminal part of the ductus deferens is dilated, which we call the ampulla of the ductus deferens. So this terminal part of the ductus deferens is called the ampulla of the ductus deferens. Then the two ampulla of the ductus deferens form this duct, which joins with the duct of the seminal gland. The seminal gland are two elongated glands on each side of the ampulla of the ductus deferens, and ductus deferens joins with the duct of the seminal gland and form the ejaculatory duct. The ductus deferens, you know that it carries sperm from the testis and it enters into the abdominopelvic cavity and it joins with the duct of the seminal gland and forms the ejaculatory duct, which courses through the prostate here. The seminal gland are two elongated gland. It is also called seminal vesicle. These are they lies obliquely behind the base of the urinary bladder. Inside, if we make a section, you can see there are glandular structures. Seminal gland secretes an alkaline fluid, which we call seminal fluid, which forms the major bulk or major portion of the semen. And this alkaline fluid or seminal fluid is rich in fructose and which helps in maintaining the survival of the sperm. The seminal gland has ducts, and duct of the seminal gland unite with the duct of the ductus deferens, and together they form the ejaculatory duct. See, here is the seminal gland behind the urinary bladder, behind the base of the urinary bladder, and that joins with the ductus deferens and that forms ejaculatory duct, which is a narrow duct which passing through the prostate. This is the section of the prostate. So ejaculatory duct passing through the prostate, and then it has opening. It opens into the prostatic part of the urethra. This is the prostatic part of the urethra. So it opens into the prostatic part of the urethra. And prostate is an almond-shaped gland, and it has a base and it has an apex inferiorly. The prostate surrounds the prostatic part of the urethra, and it also surrounds the neck of the urinary bladder. So here is the section of the prostate. It has a glandular part. The prostate secretes prostatic fluid. Prostatic fluid also joins with the seminal fluid and form the bulk of the semen. And also it has a fibromuscular part. The prostate, it surrounds the prostatic part of the urethra. See, the male urethra begins in the internal urethral orifice, and then the first part of the male urethra is passing through the prostate surrounding the prostatic part of the urethra, and then this part of the urethra is the intermediate or the membranous part of the urethra, and this is the spongious part of the urethra. The prostatic part of the urethra on its posterior aspect, this is a coronal section of the prostatic part of the urethra and the prostate, and here is the sagittal section. You can see this is the sagittal section. The pubis, behind the pubis is the urinary bladder, and at the neck of the urinary bladder, surrounding the urinary bladder, this is the prostate. These are the seminal gland, and the peritoneal cavity forms the rectovesical pouch in between the urinary bladder and the rectum here. So peritoneum goes over the seminal gland. So prostate surrounds the prostatic part of the urethra. Within the prostatic part of the urethra, there are some special features. Along its posterior border, there is a midline elevation, which we call the urethral crest. The urethral crest has a swelling or colliculus, which we call seminal colliculus. Seminal colliculus is an elevation on the urethral crest. And seminal colliculus has openings for the ejaculatory ducts. There are two small openings on each side of the seminal colliculus, which are the opening of the ejaculatory duct. See the ejaculatory duct passing through the prostate, and it opens into the seminal colliculus, which is an elevation within the urethral crest, which lies along the posterior part or posterior wall of the prostatic part of the urethra. Seminal colliculus also has a depression, which we call prostatic utricle. Prostatic utricle is an embryological remnant. It is not important that much. So ejaculatory duct openings are inferior to the prostatic utricle, but within the seminal colliculus. And ejaculatory duct carries the sperm via the ductus deferens, and also it carries the seminal fluid. On each side of the urethral crest, there are two gutters. See the two gutters or the narrow canal, which we call the prostatic sinus. These are the prostatic sinuses on each side of the urethral crest. Prostatic sinus has tiny openings, has openings for the prostatic ducts. There are several prostatic ducts open into the prostatic sinus, which carries the prostatic fluid. So the seminal fluid, the sperm, prostatic fluid, everything is entering into the prostatic part of the urethra, and all together they form the semen, and then the semen is passing through the intermediate or the membranous part of the urethra, and in surrounding the membranous part of the urethra, on each side of the intermediate part of the urethra, there are two small glands, bulbourethral glands, that secretes a little bit of lubricating fluid. And this bulbourethral gland duct opens into the spongious part of the urethra, and this fluid also joins with the semen, and then they expel through the spongious part of the urethra, going up to the external urethral orifice. So male urethra, it begins in the internal urethral orifice, and internal urethral orifice of the urinary bladder is surrounded by a muscle which we call the internal urethral sphincter muscle. An internal urethral sphincter muscle is not under voluntary control. It is supplied by the autonomic nerves. And in case of male, see, this is the prostatic part of the urethra, and this is membranous part or the intermediate part of the urethra. You can see this white line. This white line indicates the attachments of the perineal membrane. See, the perineal membrane attaches. If you draw a line from the pubis, see, this is the pubic symphysis. If you draw a line from the pubic symphysis, this white line indicates the attachment of the perineal membrane. And deep to the perineal membrane, This is the intermediate part or membranous part. That's why we call membranous urethra, because it goes through the perineal membrane. So see, this is the attachment of the perineal membrane. And deep to the perineal membrane is the deep perineal pouch, and superficial to the perineal membrane is the superficial perineal pouch. And deep to the perineal membrane, within this deep perineal pouch, this membranous part of the urethra is surrounded by a muscle. That muscle is called external urethral sphincter muscle. External urethral sphincter muscle is a skeletal muscle. It is under voluntary control. And when the external urethral sphincter muscle contracts, it stops the flow of the urine. The urinary bladder. The urinary bladder is a pelvic organ. It lies in empty state, it lies within the lesser pelvis or true pelvic cavity, and it is covered superiorly by the peritoneum. Urinary bladder has an apex anteriorly, and it has a base posteriorly, and base of the urinary bladder is related with the seminal vesicle. In case of male, it is related with the seminal vesicle, ampulla of the ductus deferens, all this. And inferiorly, there is a narrow neck of the urinary bladder, and the neck of the urinary bladder in case of male is surrounded by the prostate gland. The urinary bladder, it has a superior surface. It is a boat-shaped organ, and it has two inferolateral surface. The inferolateral surface. The urinary bladder is made up of smooth muscle, and the urinary bladder smooth muscle is called detrusor muscle. And it has a special lining epithelium that is called transitional epithelium. So I told you, inside the urinary bladder, you can see that the inside the urinary bladder, this is the internal lining epithelium of the urinary bladder, and there are openings inside the urinary bladder. There are two ureteric orifices. See, the ureter has openings and one internal urethral orifice. So if we join these two ureteric orifice, openings of the ureter, which carries urine from the kidneys on each side, and then there is one internal urethral orifice inferiorly. If we join these three openings by lines, this triangular area in the base of the urinary bladder, and it has a smooth mucosal surface. This, in between these three openings, the mucosa of the internal surface or internal lining of the urinary bladder is smooth. This area is smooth, and this is called trigone of the urinary bladder. So trigone of the urinary bladder has two ureteric openings or orifices and one internal urethral orifice. And internal urethral orifice is the beginning of the urethra, and it is surrounded by the internal urethral sphincter muscle. The female urethra is different. Female urethra is very short, approximately 4 centimeters long. Female urethra also, it begins in the internal urethral orifice, and the internal urethral orifice has the internal urethral sphincter, and these are the two ureteric orifices, and here is the trigone of the urinary bladder. Female urethra is passing through the perineal membrane. Female urethra is short, approximately 4 centimeters long. It has the external urethral orifice within the vestibule of the vagina. The vestibule of the vagina is the space in between the two labia minora. These are the labia majora and the labia minora. In between the two labia minora, there is vaginal orifice, and superiorly the external urethral orifice. So from the internal urethral orifice to the external urethral orifice, this is the female urethra. It is very short. And the female urethra, it passes through the perineal membrane, and on each side of this urethra, deep to the perineal membrane, in the deep perineal pouch, it is surrounded by muscle. And this muscle is the external urethral sphincter muscle, or the sphincter urethrae muscle. And this external urethral sphincter or sphincter urethrae muscle, it controls the flow of the urine. When it contracts, it stops the flow of the urine. Internal iliac artery is the major blood supply for all the pelvic organs, most of the pelvic organs. So already you have seen that the abdominal aorta is divided into right and left common iliac artery at the L4 vertebral levels. Each common iliac artery is dividing into two iliac arteries in front of the external sacroiliac joint, the external iliac artery and the internal iliac artery. The internal iliac artery is entering into the pelvic cavity and give rise all these branches which supply most of the pelvic organs. But there are differences between the branching pattern of the internal iliac arteries in case of male and female. In the male pelvic cavity, these are the branches of the internal iliac artery. So you can see here the external iliac artery is passing under the inguinal ligament with the external iliac vein and entering into the thigh, and it continues into the thigh as the femoral artery and the femoral vein. In the male pelvic cavity, the internal iliac artery give rise the branches. There are some anterior branches and there are some posterior branches. The very first anterior branch of the internal iliac artery is the umbilical artery. The umbilical artery is coursing over the urinary bladder, and it has an obliterated part of the umbilical artery which courses through the anterior abdominal wall. But this part of the umbilical artery has a patent part. Is patent part of the umbilical artery. It gives rise the superior vesical branches. This superior vesical artery supply the superior surface of the urinary bladder. Vesicles mean bladder. Superior surface of the urinary bladder. And then the next branch is the obturator artery. The obturator artery is coursing through the obturator canal, and it's going to supply the medial compartment of the thigh. And then in case of male, there is a named branch, the inferior vesical artery. The inferior vesical artery is a named branch only in the male pelvic cavity. Inferior vesical artery is going to the base or neck of the urinary bladder, and it supplies the male internal genital organ, mostly the prostate, seminal gland, the ampoule of the ductus deferens. Everything get blood supply from the inferior vesical artery. Then the middle rectal artery supply the middle and lower third of the rectum. And then these two branches, the inferior gluteal artery, and this is the internal pudendal artery. Inferior gluteal and internal pudendal artery, they are passing through the greater sciatic foramen, and they are going to enter into the gluteal region. And the superior gluteal artery, these branches, the superior gluteal artery is the largest branch of the internal iliac artery. And this is the lateral sacral artery, which courses lateral to the ventral sacral foramina. And there is another one, iliolumbar artery. Iliolumbar artery, lateral sacral artery, and the superior gluteal artery. These are the posterior branches. These are the posterior branches of the internal iliac artery. And all these umbilical artery, obturator artery, the inferior vesical, middle rectal, internal pudendal, inferior gluteal, all these are the anterior branches of the internal iliac artery. So obturator artery, I told you, if you follow the obturator artery, you will see it goes through the obturator canal. Obturator canal is an opening through the obturator internus muscle. You will see in the pelvic cavity, obturator internus muscle has the obturator canal through which the obturator artery, vein, and nerve is passing and going to enter into the medial compartment of the thigh. Obturator artery, sometimes it can be, if you don't see the obturator artery as a branch of the internal iliac artery, sometimes obturator artery it may arise from the inferior epigastric artery. Inferior epigastric artery is a branch of the external iliac artery. Inferior epigastric artery is passing in between the rectus abdominis muscle and the rectus sheath, and that anastomosis with the superior epigastric artery. deep to the rectus abdominis muscle within the sheath. Inferior epigastric artery, sometimes it may give rise the obturator artery, and that in that case we call that aberrant obturator artery. Aberrant obturator artery is in 20% cases, 20% of the cadavers, you will see that there is aberrant obturator artery. So obturator artery, it may arise from the as a branch of the internal iliac artery. Obturator artery can be a branch from the inferior epigastric artery. So I told you the inferior vesical artery is a named branch in case of male only. There is no inferior vesical artery in the female pelvic cavity. And inferior vesical artery, it goes to the base of the urinary bladder and it supplies the male internal genital organ, the prostate, seminal gland, the ductus deferens, all these organs. And also anterior to the prostate, there is a prostatic venous plexus. The veins within the pelvic cavity, it forms prostatic venous plexus anterior to the prostate. And you can see here the prostatic venous plexus, it receives the deep dorsal vein of the penis. Over the dorsal surface of the penis, there is one deep dorsal vein in the midline, 2 dorsal arteries, and the 2 dorsal nerve on each side. The deep dorsal vein of the penis, it goes under the pubis and it drains into the prostatic venous plexus. There is another superficial dorsal vein of the penis which drain into the superficial external pudendal vein. And deep dorsal vein is going to enter into the pelvic cavity and draining into the prostatic venous plexus. And prostatic venous plexus is important because prostatic venous plexus, it communicates with the internal vertebral venous plexus. So within the vertebral canal, inside the vertebral canal, there is internal vertebral venous plexus, and these internal vertebral venous plexus are valveless, and these internal vertebral venous plexus communicate the pelvic veins with the cranial veins, because the vertebral canal extends all the way up to the first cervical vertebra atlas, and then through the foramen magnum it communicates with the cranial veins inside the cranial cavity. And so prostatic plexus communicates with the internal vertebral venous plexus, which communicates with the cranial veins. So any cancer of the pelvic cavity the cancer metastasis can go through the prostatic venous plexus, and it can spread quickly through this internal vertebral venous plexus, which is valveless, with the cranial veins or the dural venous sinuses. That's why the prostatic venous plexus is important. I told you internal iliac artery has a branch, the superior gluteal artery. It has another one, inferior gluteal and internal pudendal. This superior gluteal, inferior gluteal, internal pudendal, these arteries are entering into the gluteal region through the greater sciatic foramen. The greater sciatic foramen is an opening right here, and through the greater sciatic foramen, these superior gluteal, inferior gluteal and internal pudendal artery entering into the gluteal region. And then superior gluteal artery and inferior gluteal artery, they supply the gluteal region. And these arteries, you can see here, they lie in between these nerves of the sacral plexus. These nerves of the sacral plexus, you can see this is L4, L5. This is called lumbosacral trunk. Here is the S1, S2, S3. So you can see the superior gluteal artery within the pelvic cavity. You will see the superior gluteal artery. It lies in between the lumbosacral trunk and the S1, the ventral rami of the first sacral spinal nerve. So if you find a branch of the internal iliac artery which is passing in between the lumbosacral trunk and the S1, that is called superior gluteal artery. And inferior gluteal artery, it courses in between, usually not, it courses in between the S2 or S3 spinal nerve, or sometimes S3 and S4 spinal nerve. And internal pudendal artery is anterior to that. internal pudendal artery, it enters the gluteal region, then it courses over the sacrospinous ligament and ischial spine with the pudendal nerve, and then it re-enters through the lesser sciatic foramen and enters into the perineal cavity, enters into the perineum with the pudendal nerve, and internal pudendal artery branches supply the perineal structures. The female pelvic cavity is a little bit different. It has different branches of the internal iliac artery. The internal iliac artery in the female pelvic cavity, it has umbilical artery, which give rise to the superior vesical branches. It has the obturator artery. But in case of female, there is an uterine artery, which is a branch of the internal iliac artery. The uterine artery crossing over the ureter. This is one of the characteristics of the uterine artery. It passes, or it courses superior to the ureter, and then uterine artery is going into the junction of the body and cervix of the uterus. Uterine artery is very tortuous. It ascends on each side of the uterus, and it supplies the uterus and a little bit of the vagina. And there is another branch, the vaginal artery, which supply the upper part of the vagina. So in case of female, there is uterine artery and vaginal artery, and there are middle rectal, there are internal pudendal, inferior gluteal, superior gluteal, all are same like the male pelvic cavity. So here you can see the uterine artery, a branch of the internal iliac artery. So uterine artery is a named branch in the female pelvis. Female pelvis that doesn't have any inferior vesical artery. Male pelvis has the inferior vesical artery, which supply the prostate seminal vesicle, and female pelvis instead doesn't have any inferior vesical artery. It is replaced by the uterine artery and vaginal artery. The uterine artery is coming here on the lateral side of the junction of the body and cervix of the uterus. This is another tortuous artery, and it ascends superiorly along the lateral side of the uterus, and it anastomoses with the ovarian artery superiorly, and inferiorly it anastomoses with the vaginal artery. Here in this picture you can see this is the uterine artery. Uterine artery, it has ascending branch and descending branch. Ascending branch goes up and it anastomoses with the ovarian artery. The ovarian arteries are the branches of the abdominal aorta. See, ovarian arteries are the branches of the abdominal aorta. They are entering into the ovary through the suspensory ligament of the ovary. And ovarian artery anastomoses with the uterine artery. And uterine artery, it crossing over the ureter. So you can remember the ureter, it carries urine. So water passes under the bridge. The bridge is the uterine artery. And this relation is important because this relation of the uterine artery and ureter is important because during hysterectomy, when the surgeons, they ligate the uterine artery, they have to be careful about the ureter. If there is a mistake, then there will be a great complication arises. So during hysterectomy, if the uterine artery ligated, then ovarian artery can give the collateral circulation. And uterine artery is very tortuous because uterus is a dynamic organ. During pregnancy, it enlarges rapidly, and also it becomes very big, and to accommodate the large size of the pregnant uterus, this uterine artery is tortuous. And uterine artery communicates with the vaginal artery. Vagina gets its blood supply from the vaginal artery. Also, in the most external aspect, the vaginal orifice and the vagina in the superficial and deep perineal pouch get the blood supply from the perineal branches of the internal pudendal artery. So here are some helpful tips to remember how the blood supply of the uterine tubes, uterine arteries and ovaries and all this. I think this will be helpful to understand the blood supply of the uterus and the vagina. And this slide, I put this slide for the lymphatic drainage. The lymphatic drainage of the pelvis and perineum is mainly they drain into the internal iliac lymph nodes. See all these green ones are the internal iliac lymph nodes. They mainly accompany with the blood supply, or mainly the arterial supply. The lymphatic blood vessels are accompanying with the arterial supply of the organs. So all these green parts of all these pelvic cavity organs, they are draining. The lymphatic drainage is into the internal iliac lymph nodes, and the yellow parts are the external iliac lymph nodes, all these external iliac lymph nodes. And the important thing is that the testis and the ovaries and the upper part of the uterus, testis, ovary, their lymphatic drainage is draining into the lumbar, or we call that the aortic lymph node, caval or aortic lymph nodes, because the testis and ovary, they develop initially into the lumbar region, and then embryologically during fetal life, testis and ovary both descends from the lumbar region. The ovaries gets its position into the inside the pelvic cavity, but testis is going outside the pelvic cavity through the deep inguinal ring, inguinal canal, superficial inguinal ring, and gets its position within the scrotum. But it gets its blood supply, nerve supply, and lymphatic drainage. So that's why the testis and ovaries, the lymphatic drainage is into the lumbar group of lymph node. And you know that the testicular artery and ovarian artery are the branches of the aorta, which comes in the lumbar region approximately at the level of the renal arteries because of their developmental origin. And this lymphatic drainage is important because in case of ovarian cancer or testicular cancer, the lumbar group of lymph node will get the metastasis of the cancer goes into the lumbar group of lymph node in case of ovarian cancer and testicular cancer. But if there is a scrotal cancer or the other part of the cancer, the scrotal cancer is going to the inguinal group of lymph node, superficial inguinal lymph node, and the prostate and the penis, all these areas are draining into the internal iliac group of lymph nodes. And here is a chart, and you can study this chart. I think this will help you to learn to study the lymphatic drainage of the pelvis and perineum. So that is the end of my second part of the second lecture. Thank you.